For Wall Street Media, this is Tyler. I'm here with Doug, and we'll help you make money in the stock market with information you can't find anywhere else.
That's always true, isn't it,
Yes,
Ty?
it is, Doug.
We had to start the camera rolling 2 minutes before we actually do. What do we have today?
We have got a roundup for you, a lineup of infectious disease companies, drug companies to fight infectious diseases.
Here at Wall Street Media, we have infectious disease for fun and profit. Only here.
Yeah, you can bring your drugs this way. We'll experiment. We've got Michael Partridge. He's the Senior Director of Communications for Vertex Pharmaceuticals. Their ticker is VRTX. He talked about their focus on Telaprevir for the treatment of hepatitis C, which is currently in phase 3 and is seeing good responses from patients.
You know, when I just went the other day to get the shots to run to Vietnam, the woman said, that was giving them to me, and no one knows where that is, so we won't get her in trouble. She was very nice. She said, oh, and here's for hepatitis A, which is good, you know, if you're going to Vietnam, or also if you're going to be in New York. I didn't say that. No, it was really funny. Yeah. And she knows she's the one at the infectious disease place.
That's kind of scary.
Yeah, I thought, like, I don't know if that's like ha-ha funny, or, you know.
She wasn't laughing, whatever it was.
Yeah. Oh, look, I had lipstick on my collar.
Oh, that's bad. Let's keep going here, though. David Standring, PhD. He's the EVP of Biology for Idenix Pharmaceuticals. Their ticker is IDIX. He talked about their drug candidates, highlighting Tyzeca Sebivo for hepatitis B, which is now in about 50 countries, only 1 year after launch. He said they're heavily focused on HCV and developing and partnering their HIV compound as well. They hope to announce a partner before the end of the year. We've got Will Roberts, the VP of Corporate Communications for Viopharm. Their ticker is VPHM. He talked about Cinryze targeting hereditary angioedema. He said, I'm going to start off without talking about an infectious disease, if that's okay with everyone, and everyone said, cool. So
they let him into the party.
Yeah, they did. He made up for it later. But he started out talking about Cinryze targeting hereditary angioedema, which was approved by the FDA on October 10th.
And see, this, guys, I've been telling you, biotech basket. Let me tell you, the first big, beautiful thing we love to see is a management team that gets something approved by the FDA.
Yep.
Wonderful.
It's a long, hard road to get there.
Yeah, it takes you out of the blue sky and the pie in the sky categories, right? And puts you into like, okay, these guys been there before.
Yeah.
Act like you've been there before, Tyler.
Don't touch me. You're full of infectious diseases. Don't touch me. Cinryze, they expect to have the product available in the pipeline for sale by the beginning of November. And then he talked about Maribavir.
December.
Whoa, did I say November?
Yes, you did. You were close. You were close. Have some more of my tea.
Yeah, we've slept about 6 hours in the past week. December, the beginning of December, because that would make it the past if it were November.
That's
which
right.
Would be really interesting.
You're an interesting kid.
Sometimes. He also talked about Maribavir, which blocks the replication and spread of cytomegalovirus, the most frequent viral illness within infected cells. The drug has orphan drug status in both the U.S. and Europe. We've got Steve Warland, the president and CEO of Anadys Pharmaceuticals. Ticker is ANDS. He talked about their 2 compounds in development for the treatment.
I'm going to roll the dice here and say that they might be Anadys.
Okay. ANDS, he talked about their 2 compounds in development for the treatment of hepatitis C. The viral load data for ANA 598 is expected in Q1 09, and they're planning for the phase 2 trial, which is underway and should be ready in mid-09. For ANA 773, they expect viral load data in Q1 of 09 with a complete data set in Q2 09. Michael Bonney, President and CEO of Cubist Pharmaceuticals, ticker CBST. He talked about optimizing Cubicin to continue to penetrate the U.S. hospital market, the hospital market, focusing on the outpatient while international launches continue. He also said they have 2 internal programs with 2008 INDs planned in gram-negative antibiotic and CDAD antibiotic. And
nice one. And we've got Ziopharm's Analyst Day.
Yes, sir, we do.
What'd they say, Ty?
Well, the Analyst Day, a bunch of different people talk. So first up was Larry Norton. He's the Deputy Physician-in-Chief for breast cancer programs. He talked about the development of a program for Indibulin, which is a novel synthetic anti-cancer agent that targets mitosis. After him was Robert Mackey, the co-director of the Adult Sarcoma Program and assistant member for the Department of Medicine. Spoke about...
Oh, this is their big drug, right?
Yeah, it's got a long name, too.
Polifostimide.
Yep.
That drug.
Yep.
Yeah, okay.
Which is in randomized phase 2 study for treating soft tissue sarcoma. It's less toxic than ifosfamide and thus could be applied to an older population. There's a possibility of synergy with another one that I haven't slept in forever. Doxorubicin. Ah, that was good.
Yeah, you are good at these. Especially for being no sleep boy.
After him was Dr. Wilson Miller, the professor and director of medicine and oncology at McGill University. He described traditional Chinese medicine. Arsenic is being used today in cancer treatment. Also talked about darinaparsin for advanced lymphomas, which is in a phase 2, and oral darinaparsin, which is in phase 1. After him was Joseph Bertino, director and chief scientific officer. He spoke about the pipeline progress. Zymphos, palifosfamide for testicular cancer, sarcoma, and lymphoma is in a phase 2 trial. Zybulin, which is the indibulin anti-cancer agent, is at the end of phase 1. And Zinapar, which is the darinaparsin anti-hematological cancer, is at the end of phase 2.
That's fantastic stuff, Tyler. Only here on Wall Street Media can you find infectious disease for fun and profit.
Yep, you know? For fun and profit.
Let me tell you something, guys. Ziopharm are a pretty sharp outfit. Their ticker's ZIOP. They're on the NASDAQ, right? And I'm looking right now, and at this moment, there's a buy order for 12,100 shares, and there's one sell order for 100 shares.
Whoa.
So the momentum is looking strong, right? 12,000 are trying to buy, 100 trying to sell.
Wow, nice.
Right? They're at $1 a share, right? It's early. You're rolling the dice, but these guys are somebody that definitely deserves some consideration for your biotech basket, which I talk about endlessly. Come back to the site and look at. Mm-hmm. You should have one. This is going to be the next revolution. These guys are all working on hepatitis, cancer, right? One helping out with your heart and your heart disease. Wonderful stuff, man. Mm-hmm. Come back to the site, do your research, and think about a biotech basket. You really ought to get one. Thanks, Tyler.
My pleasure, Doug.
Let's go find German Mike's drink and put something in it.
Yeah, with like cough in it and stuff. That'll be fun.
All right.
We're here every day, Wall Street Media. You can find us directly at WSMCO.com. Thanks.